Welcome, everybody. Thank you for joining us. Today, we're going to be talking about the Wisconsin Voices for Recovery ED2 Recovery Plus program. So I'll just go around and we'll just do some brief introductions. So my name is Cindy Brzezinski. I'm the Director of Wisconsin Voices for Recovery. We also have Kelly Juris, the ED2 Recovery Plus program coordinator, Christopher Zahn, the Wisconsin Voices for Recovery community liaison, Jill Lindwall, the quality director at the Wisconsin Hospital Association, and a special guest, Amy Vang from Bellin Health, the emergency department team leader. So this webinar is offered as a joint collaboration between Wisconsin Voices for Recovery's ED2Recovery Plus program, the Wisconsin Hospital Association Program for Research, Outreach, Therapeutics, and Education in the Addictions, or PROTEA, through the Wisconsin Rural Health and Substance Use Clinical Support Program, also known as RHeSUS. Funding for RHeSUS was provided by the UW School of Medicine and Public Health from the Wisconsin Partnership Program. So thank you all again for joining. Next slide, please. All right, so today we are going to cover a variety of topics. So we just did some brief introductions. We're going to talk a little bit about Wisconsin Voices for Recovery as an organization to help you get more familiar with us. We'll be talking about the ED2 Recovery Plus program, providing an overview and covering a little bit about peer support for those of you who may not be familiar with that. And we'll also talk about ED2 Recovery Plus program operations, so those internal logistics of participating in this program. And then we're going to talk about impact and benefits of peer support. We'll have Bellin Health, Amy Vang, talk about the hospital experience with ED2 Recovery Plus, and they are a current program participant. And then we'll also wrap it up with ED2 Recovery Plus funding opportunities, which will be released in June 2023. Next slide, please. All right, so Wisconsin Voices for Recovery is a statewide recovery-focused organization. We are actually part of the UW Department of Family Medicine and Community Health at UW-Madison. We started in 2013 with over 20,000 people reached, and our team structure includes 7 team members, 4 programs, an advisory council, and a BIPOC community advisory committee. Next slide, please. So what we do is we focus on connecting people within the recovery community, those impacted by addiction and recovery and advocacy organizations. We reduce stigma. We provide support for harm reduction. We also provide peer support providers, organizations, support. And then we educate people on addiction and recovery. Next slide, please. So going into a little bit more detail, so to connect people, we have an annual rally for recovery. We hold stigma awareness events. We do social media engagement. We have a Saturday night chat forum where people can share their own recovery story. We have a sober podcast where we talk about various topics and organizations that are supportive of recovery. And we are currently in the development stages of a peer support directory. We also work to reduce stigma. We have stigma reduction campaigns. We do trainings and presentations. We have a forum on Speak Out on Stigma, interviews where people share their experiences on stigma. And we also provide education on stigma. The education we provide on addiction recovery includes peer support, recovery, addiction, stigma, harm reduction, and advocacy for topics. Next slide, please. And we also provide peer support provider orgs that provide peer support. So through that, we provide free CCAR recovery coach trainings, virtual peer support conference each year, the ED2 Recovery Plus program, which we're going to be talking about today, and funding for peer support providers, and also technical assistance. We also engage in harm reduction efforts. So we have our naloxone program. We provide Narcan to the community, and also we'll be implementing a fentanyl test strip program as well. We also provide Narcan administration trainings. Next slide, please. All right, so we're going to talk a little bit now about the ED2 Recovery Plus program. Next slide. This program started in 2017 and it supports provision of peer support services. We are currently funded through both SOAR 3 and ARPA, and requests for proposal occur annually. So ED2Recovery Plus is a program overseen by Wisconsin Voices for Recovery that supports provision of peer support services by recovery coaches or certified peer specialists. ED2Recovery Plus currently supports services that are occurring in over 32 hospital sites statewide, provided by 7 recovery community organizations offering referrals, support, and follow-up for treatment and recovery to individuals that have experienced an opioid overdose. ED2Recovery Plus also supports provision of peer support services outside of emergency department settings, including destinations where an individual may have experienced an opioid overdose, including but not limited to EMT services, first responders, public health departments, probation and parole offices, law enforcement, treatment and or recovery centers. This program began by providing funding for peer support for opioid referrals from the ED, then expanded to include community and first responder referrals, and then further expanded to provide peer support for stimulant referrals. And just as a side note, it is not required to receive funding from us to participate in this program. If you have any questions about this, please do email us at ed2recovery@fammed.wisc.edu, which will be listed on the final slide of this presentation. Next slide, please. So this is a map of our current program coverage. We are actually looking to expand the reach of this program, which is part of the reason for this webinar. So as you can see, we are located in a number of counties across the state and are looking to expand. Next slide, please. This is just a quick graph of the overall benefit of the ED2Recovery Plus program from the hospital perspective. So 21 hospitals were asked about overall benefit of the ED2Recovery Plus program, and 31 surveys were returned indicating the program is beneficial, with the majority indicating it was extremely beneficial at a 10 and an average rating of 8.4. Next slide, please. So the ED2Recovery program goal is to unite treatment systems to promote peer support that will decrease the number of overdose fatalities in Wisconsin, increase treatment and recovery support, reduce emergency department admissions due to overdoses, provide peer support services in community settings, and be a sustainable and collaborative peer support network. Next slide. We also provide support to the 211 program. So the 211 program connects individuals seeking recovery resources and services to those services. So the first step is that a person looking for opioid or stimulant recovery resources calls 211. The second step is if they would like to talk to peer support, 211 transfers them to the ED2Recovery Plus hub. And then the third step is if continued peer support is requested, the hub or a closer ED2Recovery Plus organization provides it. Next slide, please. So what is peer support? So it's delivered by individuals who have common life experiences with people they are serving. There's a unique capacity to help each other based on a shared affiliation and deep understanding of this experience. They offer support, strength, and hope to their peers, which allows for personal growth, wellness promotion, and recovery. Peer support services can help assist recoverees through all stages of their recovery and in a variety of clinical and community settings. Being able to connect with someone who has lived experience is important to those in or seeking recovery. Recovery coaches and certified peer specialists can help people become and stay engaged in the recovery process, which helps reduce the likelihood of relapse. Relapse increases the risk of fatal opioid overdose, and peer support services can play a key role in linking recoverees to resources in their area, including medications for opioid use disorder. According to the Substance Abuse and Mental Health Services Administration, or SAMHSA, peer support services are delivered by individuals who have common life experiences with the people they are serving. People with mental and or substance use disorders have unique capacity to help each other based on a shared affiliation and a deep understanding of this experience. In self-help and mutual support, people offer this support, strength, and hope to their peers, which allows for personal growth, wellness, promotion, and recovery. Next slide, please. So this is a little bit about what is peer support and how it works. So the recovery arrives to the emergency department, so they meet. The recovery coach or peer support specialist is connected by the ED. And then the recovery coach or peer support specialist works with the recovery to provide support and connect to recovery resources. Within the emergency department setting, peer support providers, 1, engage with those that have survived an overdose. 2, listen and be present to answer questions patients may have about recovery supports or treatment options. And 3, provide information to family members. The peer support provider works with an individual who has just been through a very traumatic event. They may also be angry, shocked, or confused as to why or how they ended up in the emergency department. They may also be feeling acute withdrawal symptoms. In some, the peer support provider might be the last person that they want to talk to, and they may not be ready to talk about recovery or treatment options at all. The most important role of the peer support provider will be to just be there with the individual, listen and empathize. Their presence as a peer in recovery may just be the glimpse of hope that the individual needs, and they might be willing to engage in some type of support immediately, whereas trust is built over time. Now I'm going to pass it over to Kelly to talk a little bit about the ED2Recovery Plus operations.
All right, thanks, Cindy. So part of our operations is providing supervision and support, which we do through free technical assistance, monthly group supervisor meetings, monthly one-on-one site meetings, and an annual in-person site visit in lieu of the one-on-one meeting that month, which we also visit the hospital partners. We also provide some training. So we have quarterly recovery coach trainings that are 1 hour, and they are offered 2 times that specific day each quarter. We, because there are 4, we gear 2 of them towards more experience learning, and then the other 2 are more educational. We also hold an annual virtual conference, which is 1 to 2 days, which we provide CEUs for the coaches who attend. And part of it is that our partners have input on the topics we cover. Along with that, we have a supervisor training that's annual, and it's a 4-topic geared towards the supervisors. Again, supervisors have an input of the topics covered, and some examples of those would be sustainability, REDCap data, and motivational interviewing. So we use a referral database, which is the REDCap system for the referral service tracking. It's secure and it's tied to monthly invoicing. It must be kept up to date in real time. And within REDCap, there are access to data reports that are already created, as well as you can create your own. And then we have invoicing, which is submitted monthly. And then the REDCap data needs to match those referrals. So now I will pass it over to Christopher.
Thank you, Kelly. So I'm very honored to have this opportunity to talk about peer support. So when we talk about peer support, we're talking about cultivating relationships that are built on trust, respect, empathy, mutual experience, and choice. Offering support through validation, encouragement, empowerment, and highlighting strengths. It's sharing their personal experience when appropriate to inspire hope, recognizing a person's personal beliefs, cultural values, previous experiences, and individual needs, providing education about recovery, advocating for oneself, and how to navigate treatment or the healthcare system. Peer support services are often successful in addition to other professional mental health or medical services. So that sums up what the role of peer support is and the reason why it is so important. And Kelly, if we can go to the next slide. So as you can see, I'm a certified peer specialist, and one of the requirements in Wisconsin is to be a certified peer specialist, you're required to have lived experience with substance use disorder and/or mental health disorder. If I didn't have peer support in my life, and to be quite honest, I wouldn't be alive today. It was peer support in my life that has given me the opportunity to be in long-term recovery now. I struggled with my own personal addiction for 25 years. And it was that complex system that is out there. It is so difficult to navigate. There's so many different questions. Where do I get that help? Where do I go? There's the fear of actually even going to support meetings, you know, and that's in the role of the peer support. It's to have that education and build that recovery capital, that internal and external resources necessary to begin and maintain recovery. I didn't know what those were. I didn't really have that internal sources. I didn't know what the external resources were. And it was peer support that came into my life, and having that opportunity to know that there was somebody else with that shared experience that had lived it and was in long-term recovery, that made the difference. It didn't seem so scary to me anymore that somebody was willing to walk with me on my journey. And now, thankfully, because of that, I have achieved long-term recovery. That's why, you know, I have this opportunity to be very much involved in peer support and get others and walk with them on their journeys. And to have these programs and let people share their experience with one another is really what's sustainable in maintaining that recovery and starting the recovery journey. So that's a little bit about my story and why it works. Because if I didn't have it, I wouldn't be here today. Next slide, Kelly. So there is peer support core competencies. You know, Wisconsin does have a training component, and also it's a recertification every 2 years where you're required to have CEUs to maintain your certification. But SAMHSA has came up with the core competencies, and it's also what core competencies that are very similar to Wisconsin. It is recovery oriented. It empowers people to choose recovery and find meaning and purpose throughout the process. It's person-centered. It's about that person in recovery, their wants, their needs, their desires, how they can achieve success. It's voluntary. It prioritizes autonomy, choice, and collaboration. It's relationship focused. It's trauma informed. So we do have these out there, and you know, having the healthcare systems reach out for peer support and let people know that there is an opportunity for that person to have somebody walk with them on their recovery journey, that is so important. And that's why, you know, like I've said, even in my own life, if I didn't have it, I wouldn't have achieved the long-term recovery that I have. So thank you so much for your time. And I will now turn it over to Amy Vang.
Thank you, Christopher. Thank you, everybody, for inviting me to be here. It's very, very nice to be here and to talk about the impact that this program has had in our community. We partner with, our grant is partnered with RHeSUS and Bellin, and then we have Darjun Recovery, who supplies and supports us with the peer support specialists that come into our ED. You can go to the next slide. So background and startup, we've been in the program since, I believe, 2018. We're on our 5th cycle with the grant. And we identified the need for the program in our service area based on a community health assessment that was done back in 2018. And we know that we needed substance abuse, needed help with substance abuse, and opioid specialties was part of the top 3 improvement initiatives for our community. Bellin often operated on a population health model, and we want to make improvements in our community as much as we can. So this was a great grant to get involved with. We established relationships in the community. We had already been forming a relationship with Darjun Recovery. And so we decided to apply to the grant program. And then to implement and get backing from the stakeholders, they went out to the clinics, they talked with providers, talked with staff, really gained support for the program. And then again, just continuously showing the data for improvement and the impact that this program has on our community was something that was really beneficial. Next slide, please. So when we implemented and applied for the grant, we first had to understand the grant requirements and get the data, get the buy-in from the key stakeholders with us and our administration and with the community. We had to have human resources help us with the contracts with Darjun, and then educate the nursing and the provider staff within our department. And then as we eventually grew the program throughout the system, we initiated a call schedule for the recovery coaches so that we always had someone who is available 24/7 to come into the ED when we had a patient who needed the services. And then, as Kelly mentioned, the support from the grant and the program, we meet monthly and review the data. They're able to help us kind of work through any of the troubleshooting that we have, and they're really supportive of the grant and helping hospitals make this just work for the community that needs it. You can go to the next slide. So where are we identifying the patients? Obviously, the program is called ED2Recovery, and a lot of our patients are identified through overdoses through the emergency department. So it started in the ED initially through our cycle 4 of the grant. We had 371 referrals out of the ED, which is quite substantial. We know that the staff are well trained to identify patients that meet criteria for needing a recovery coach referral, and just, hardwiring into our nursing staff that this is a program that we have available to assist our patients with has been very beneficial. We've expanded it to our primary care clinics as well, as we can refer out to a recovery peer specialist when the patients are admitted to the hospital. So if we have a patient who comes in who overdoses, maybe at that time isn't really the right time to consult a recovery coach or a peer specialist, we can do so once they are up in, say, the intensive care unit, and they're a little bit more able to move forward with the referral and take that assistance. You can go to the next slide. So the process for recovery coach referrals with us, we obviously first and foremost will consult the peer specialist through the emergency department. But again, we've outlined to our primary care clinics. We have our O'Connell Hospital involved. Our nurse, resource case manager, or the provider in the ED can identify a patient that meets criteria for the consult. Again, we have our peer specialists on call 24 hours a day to be able to come in and complete that initial assessment and make that initial rapport with the patient, be that support that they need during their emergency department visit. And then after the patient is discharged, the program follows them through to be able to give them the support that they need to either hopefully become sober or decrease their use, or provide the references and support that they need in the community, just as Christopher had said. Next slide, please. Darjun currently, the partnership that we have, they have 18 recovery coaches total. Currently 4 recovery coaches take call for our hospital. And they have about 175 active clients in the program. 50 of those clients who right now are consistently utilizing the peer support specialist, either on a daily, weekly, or monthly basis. So the impact of this program is huge. You can go to the next slide. Just some overall data review. In our first year, cycle 1 of the grant, you can see here that we had 80 referrals out of the emergency department. And total, we had 92 referrals to the program. Next slide. And then as of the last, just the last cycle 4 grant season, we had 106 referrals out of the emergency department. So the program has continued to grow. We continue to improve in identifying patients that need peer support specialists. And it, again, just links those patients to the resources in the community that they need. Next slide. Here is just some generalized data on the substances in our community. You can see that in the span of our grant cycles, 13% is with opioids. Some of the patients are using multiple substances. We have cocaine, heroin, methamphetamines, and then a combination of meth and heroin as well. Next slide, please. And then since the program started in 2018, we've had a total of 583 patients referred to Darjeon for the recovery peer specialists. 198 of those, or 34%, are completely sober. We've had 75 that are using medication-assisted treatment. 84 or 14% have reduced their use of substances. And we do have a substantial number that, for whatever reason, this just isn't the time for them and we can't get in contact with them after initial consult. Next slide. So cycle 4, our last cycle, we've had a total of 60 patients become sober. So that's 36% of the referrals that we've made. 20 are on medication-assisted treatment, which is 12% of the referrals. 15.6% of the referrals are reducing their usage. And again, we have 27% in which just we can't contact after the initial referral in the ED. And then 15, unfortunately, are still trying to recover and have a high relapse rate. Next slide. So using recovery coaches in the emergency department can help bridge the resources for patients in our community to recovery. And so it can be very beneficial to link them to the resources. It decreases ED visits, decreases the ED wait times, because we're able to link them to that resource pretty quickly once we've identified the patient meets criteria for recovery support. Decreases the crime in the community, gives them, it's help available for anyone and everyone that needs it, and just prevents drug-related deaths in our community, which is huge. Thank you.
Great, thank you, Amy. So now we're going to talk about the RFP specifically. So this will be coming out during the month of June. Next slide, please. So first, I'm going to give a little project summary. So Wisconsin Voices for Recovery at the Department of Family Medicine and Community Health will continue to oversee the ED2Recovery Plus program through regrant awards to organizations who will offer peer support services by recovery coaches or certified peer specialists. These services are currently occurring in several hospital states statewide, offering referrals, support, and follow-up for treatment and recovery to individuals that have experienced an opioid or stimulant overdose. Recovery coaches and certified peer support specialists may also offer services outside of emergency department settings, including destinations where an individual may have experienced an opioid or stimulant overdose, including but not limited to EMT services, first responders, public health departments, probation and parole offices, law enforcement, and treatment and/or recovery centers. The ultimate goal of the program is to unite treatment systems to promote peer support services that will decrease the number of overdose fatalities in Wisconsin, increase treatment and recovery support service utilization of the target population, reduce emergency department admissions due to overdoses, provide peer support services in community settings, and be a sustainable and collaborative peer support network. Next slide, please. So there are some required qualifications, and this content in this current section about the RFP comes directly from the RFP. So recipients of this funding must be a public or nonprofit 501c3 organization or qualify as a state, local, or tribal government located in the state of Wisconsin and must assure adherence to state and federal law and grant requirements. Include peers in management, service delivery, board of directors, and/or advisory capacity. And 3, have liability insurance or include purchase of a liability insurance as part of the use of grant funds. Next slide, please. So there are several scored competencies that we look at: program oversight and infrastructure, recovery guiding principles and values, ethical practices, peer leadership development practices, and management and support systems. Next slide, please. So a little bit about the sections of the proposal. There are 6 sections. The first one is the project narrative, followed by the justification, the project budget, letters of commitment, stakeholder involvement plan, and sustainability plan. Next slide, please. So looking at the contract award information, the total amount of awarded funding per organization will depend on the quality, scope, and budget justifications of the submitted applications. The application for this funding does not guarantee award. Anticipated minimum award to funded organizations is $25,000. Multiple awards may be awarded and budget revisions may be requested. Next slide, please. So this year we will actually be having 2 RFPs, requests for proposals, put out. The first one will be for organizations that have previously received SOAR funding through Wisconsin Voices for Recovery ED2Recovery Plus program. The second RFP will be for organizations that have not previously received SOAR funding through Wisconsin Voices for Recovery ED2Recovery Plus program. Next slide, please. So this is a timeline of applicable dates. This timeline applies to both RFPs. So they will both be issued on Friday, June 16th of this year. The written questions that you may have from the proposal are due by 6/30/23 at 4 p.m. Central Time. The proposer conference call, which includes responses to those questions, will occur on July 7th, either at 3 o'clock or 4 o'clock p.m. Central Time, and that time depends on the RFP. The proposal due date will be August 18th before 5 p.m. Central Time. Late proposals will not be accepted under any circumstances. The award notification will happen approximately September 15th before 5 p.m. Central Time, and the contract term begins on September 30th, 2023. Next slide, please. If you have any questions about this webinar, the RFP, the ED2Recovery program, you can contact us at ed2recovery@famed.wisc.edu. So please do keep your eyes open for that RFP. Both of them, they will be shared on our social media, also in our newsletter and other means as well. Thank you.